Most parents notice something before anyone else does. Not a teacher, not a doctor, not a specialist, with a clipboard and a checklist. You. A quiet feeling that something is slightly different. That your child is developing along a path that does not quite match what you see in other children their age. That certain milestones are delayed, or certain behaviors feel unusual, or your child seems to inhabit their own world in a way you cannot fully reach into. That feeling is not anxiety. It is not overreaction. It is one of the most reliable early detection instruments in existence, and the research supports that. Studies consistently show that parents are remarkably accurate reporters of their child's developmental differences, often noticing something is different months before a formal evaluation confirms it. The problem is not that parents are wrong, the problem is that they do not always know what they are seeing. They have a signal, but no language for it. Today, I am going to give you that language. This video will walk you through the specific, research-backed early signs of autism spectrum disorder at every developmental stage from infancy through early childhood. Not to alarm you, not to hand you a diagnosis from a screen, but because the research is unambiguous on one point, early detection changes outcomes. The earlier a child receives support, the more difference that support makes in communication, in social development, in quality of life. So if something brought you here today, a worry, a question, a behavior you cannot explain, stay with me. Let's begin from what autism actually is. Before we get into specific behaviors, I want to make sure we are starting from an accurate picture. Because a lot of what makes the signs hard to identify is that the popular image of autism is often incomplete. Autism Spectrum Disorder (ASD) is a neurodevelopmental condition, not a disease, not damage, not the result of parenting choices or vaccines or diet. It is a difference in how the brain develops, processes social information, handles sensory input, and organizes communication. The word spectrum is critical. Autism presents across an enormous range of profiles. Some autistic children are highly verbal but use language in socially unusual ways. Some are nonverbal. Some have exceptional abilities in specific domains. What connects them is a pattern of differences in social communication, sensory processing, and often a strong preference for routine and predictability. A 2024 review published in the journal Children described autism as a neurodevelopmental condition characterized by challenges in communication, social interaction, and repetitive behaviors that can emerge as early as the first year of life. That last detail, the first year of life, is what makes early recognition so important and so possible. The signs do not appear all at once. They unfold, and if you know what to look for at each stage, you can see them as they emerge. 6 months. The sign most parents miss. Here is the thing about autism signs at 6 months. They are not what most parents expect. Most people imagine early autism as obvious: a baby who never smiles, never responds, who is clearly different from birth. The research shows something more nuanced. A landmark prospective longitudinal study published in JAMA followed 25 infants later diagnosed with ASD and 25 children with typical development, assessing them at 6, 12, 18, 24, and 36 months. What they found at 6 months was striking. The two groups were largely comparable. Frequencies of gaze to faces, social smiles, and directed vocalizations were highly similar at 6 months. But a declining trajectory was already beginning. That word declining is the key. The earliest sign of autism in infancy is often not an absence, it is a fading. Skills that were present begin to retreat. Social engagement that appeared on track begins to diminish. And because the starting point looked typical, parents often do not notice the change they remember, the smiles that were there, not the point at which they began appearing less often. What you are watching for at 6 months is not a child who never smiles. It is a child whose social smiling feels less consistent, less reciprocal, less reliably triggered by your face than it was a month or two ago. A baby whose gaze seems to move through you rather than landing on you with recognition. If the social responsiveness feels muted or inconsistent, not absent, but fading, that is worth paying attention to. Not with alarm, with awareness. 9 months. The name and the gaze. By 9 months, two behaviors become visible that the research identifies as among the earliest reliable indicators of autism. The first is name response. By 9 months, most babies show a consistent pattern of turning and orienting when their name is called. Not every time babies are distracted, absorbed, tired, but as a pattern, The typical 9-month-old recognizes and responds to the sound of their own name. A 2017 study confirmed what researchers had observed clinically for years. Autistic babies often do not respond to their names at 9 months. The key phrase is pattern of non-response. A single missed response is meaningless. What matters is the consistent, repeated absence of orientation across multiple instances and contexts. If you call your child's name 10 times in ordinary moments, not during deep absorption in something else, and they rarely turn or orient, that pattern is worth raising with your pediatrician. The second sign is the early development of joint attention. Joint attention is one of the most studied early markers of autism. It is the ability to share focus on an object or event with another person, to look at something, then look at the person, then look back, using gaze as a communication channel. It is the infant's first true conversation. By 9 months, most typically developing babies begin following your gaze when you look at something, looking back at your face after examining an interesting object, and orienting to where you point. Children on the autism spectrum consistently show delayed or reduced joint attention. At 9 months, this begins to be visible in the quality of shared gaze: the baby who looks at a toy but never checks your face. The baby who does not follow your gaze across the room, in the world alongside you rather than with you. 12 months. 3 red flags. By 12 months, 3 specific behaviors are developmentally expected. Their consistent absence is recognized as a red flag on every major autism screening tool. The first is pointing. Not reaching for objects, pointing with the index finger to show you something of interest. This distinction matters enormously in autism research. Instrumental pointing means pointing to get something. Declarative pointing means pointing to share an experience. Look at that. Do you see what I see? Declarative pointing is fundamentally a social act. It requires understanding that another person has a perspective worth sharing. Research published in Frontiers in Psychology found that children at risk for ASD showed significantly lower rates of pointing gestures than neurotypical peers, with this difference beginning around 12 months and becoming more distinct by 18. The second red flag is waving. A simple gesture, easily overlooked. But the social wave hello, goodbye requires understanding that gesture carries meaning, that interaction follows patterns, that the arrival and departure of people is an occasion for social acknowledgement. Absent waving at 12 months is listed as a red flag on clinical screening tools because it represents not just a missing gesture, but a missing understanding of social ritual. The third is babbling with social intent. 12-month-old babies babble as communication, practicing turn-taking, varying intonation, directing vocalizations at people. Little or no babbling by 12 months, or babbling that is not directed at anyone and does not vary with social context, is worth attention. These 3 behaviors, pointing, waving, socially directed babbling, collectively represent the emerging architecture of human communication. When all 3 are significantly reduced or absent, that picture warrants a conversation with your pediatrician. 18 months, the window that matters most. 18 months is the age that appears most prominently in autism research. It is the first recommended formal screening point using a validated tool, the MCHAT, the modified checklist for autism in toddlers, and the age at which signs that were subtle earlier have become clear enough for initial clinical evaluation. 3 signs deserve specific attention. The first is language delay or regression. Most children have at least a small vocabulary by 18 months. But the sign that most distresses parents is not the absence of language, it is the loss of language that was previously present. Developmental regression in autism is well documented. The research places it most often between the first and second birthdays, with mean ages across studies ranging from 16 to 20 months. A child who is saying words and then stops. A child who was showing social engagement and then withdraws. If your child had language and lost it, this warrants immediate evaluation, not a wait-and-see approach. The second sign is not following a pointed finger. When you point at something, your child should look at what you are pointing at, not at your hand. Following a point requires understanding it as a message about something beyond the pointer. Most children do this by 12 to 14 months. By 18 months, failure to follow a point consistently is a clear red flag. The American Academy of Pediatrics notes that children on the autism spectrum may appear to ignore the parent when they point, which is sometimes mistaken for a hearing problem. A child who passes a hearing test but does not follow points or respond to their name is showing a social communication difference, not a hearing one. The third is instrumental use of the caregiver. Watch how your child expresses what they want. A typically developing toddler points, reaches, and makes eye contact, simultaneously making the adult a participant in the request. An autistic child at this stage may take your hand, walk you to what they want, and place your hand on it without looking at your face. They use your hand as a tool. Your presence as a social partner holds no particular significance in that moment. This is not coldness or lack of love. It is the absence of a specific social communication framework that most children develop spontaneously. 2 to 3 years. 3 more signs. By 2 to 3 years, the earlier signs are typically clearer. 3 new ones also emerge that are specific to autism and important to name. The first is repetitive behavior. This takes many forms, lining up objects and becoming distressed when they are disturbed, spinning a toy car's wheels rather than rolling it, repeating phrases from television word for word, called echolalia, or physical repetitive movements like rocking, hand flapping, or spinning, collectively called stimming. These behaviors serve a genuine function. They are the nervous system regulating itself in a world that can feel overwhelming. They are not bad behavior, but their presence, paired with the earlier social communication signs, is diagnostically significant. The second is insistence on sameness. The route to the park must be the same. Breakfast must look identical to yesterday's. The shirt must have the tag removed. When routines change without warning, the response is not ordinary toddler frustration, it is genuine nervous system dysregulation. A child whose distress at routine disruption is intense, persistent, and disproportionate to the situation is showing something clinically meaningful. The third is sensory differences. Sensory processing differences affect over 90% of autistic children. These appear in both directions. Hypersensitivity, covering ears in a restaurant, refusing food based on texture, being unable to tolerate seams in socks or tags in shirts, showing extreme distress in busy environments. Hyposensitivity, crashing into furniture, not seeming to feel pain normally, needing to touch every surface in a new environment, seeking deep pressure. By 2 to 3 years, parents have often begun accommodating these sensory patterns without connecting them to the larger developmental picture. The signs that hide in plain sight. Several patterns consistently slip through undetected, not because they are subtle, but because they are easy to misname. The first is the child described as unusually independent. An autistic child who does not seek shared enjoyment, who does not bring you things to look at, does not check your face when they accomplish something, can look like an exceptionally self-sufficient child. What is actually absent is the social motivation that typically drives children to seek shared experience. The child is not experiencing connection as a pull worth responding to. That difference is easy to miss when the behavior looks, on the surface, like a virtue. The second is the highly verbal, but differently social child. Some autistic children develop large vocabularies early and have detailed knowledge of specific topics. What distinguishes this from typical development is not the vocabulary, but how the language is used, more monologue than dialogue, more information delivery than conversational exchange, more centered on the topic than the person. An autistic child talking about trains is not talking with you about trains. They are delivering a presentation about trains in your direction. The third is inconsistent eye contact. Eye contact in autism is not simply absent. It is inconsistent in ways that are easy to rationalize, good during familiar routines, but not during genuinely novel social moments, present when asking for something but avoided when emotional content is present, slightly off in timing or quality in ways that are hard to articulate. It is often what parents are trying to name when they say something feels different. What to do when you recognize these signs? First, trust your observation. The research is clear. When parents report developmental concerns, those concerns are reliable. You are not catastrophizing. You are noticing a pattern that deserves evaluation. Second, do not wait for the next routine appointment. Request a developmental evaluation directly. You can tell your pediatrician, I have noticed specific behaviors I want evaluated, and I am not comfortable waiting. Arrive with written observations, specific behaviors, specific ages, specific patterns. Do not minimize what you have seen. Third, ask for a referral to a developmental pediatrician or ASD evaluation team if your general practitioner does not feel equipped to assess what you are describing. The MCHAT-R is a valuable screening tool. but a failed screening requires follow-up evaluation, not reassurance that the child will catch up. Fourth, understand that a diagnosis is a beginning. It is not a verdict or a ceiling. It is a doorway to services, support, and understanding. The research on early intervention is consistent. Children who receive appropriate support before age 3 show meaningfully better outcomes in communication, social skills, and adaptive behavior than children who receive the same support later. The earlier you act on what you are seeing, the more of a difference that action makes. What these signs are not. Before this video ends, something needs to be said clearly. Not every child who does not point at 12 months has autism. Not every late talker is autistic. Development is variable. What you are looking for is not isolated instances of any of these behaviors. You are looking for clusters, multiple signs appearing together, persisting over time, not resolving as the child develops, specifically affecting social communication, repetitive behavior, and sensory processing. This video is not designed to send you into a spiral after every missed smile or unanswered name call. It is designed to give you a map so that if you are looking at a cluster of these signs across multiple domains, persisting over months, you have language for what you are seeing and confidence to bring it forward. You are your child's first advocate. The research says you are usually right. There is a particular kind of loneliness in watching your child develop differently and not having words for what you are seeing. You know something. You cannot quite name it. The people around you offer reassurance that may or may not be earned. The appointments are spaced far apart, and you are carrying a question that no one has answered yet. What this video can do is make that question more specific, more visible, more possible to bring into a room with someone who can help you find the answer. You noticed something. That matters because what you noticed is probably real, and real things seen early can be met early. Go make the appointment. Write down what you have seen. Describe it specifically, and without minimizing it. And know that the act of paying this kind of attention to your child is one of the most important things a parent can do. Whatever comes next, you are already doing the most important part. If this video gave you clarity on something you have been watching, share it with a parent who needs to hear it. Leave a comment telling me what brought you here today. And subscribe, because this channel exists to give parents the research they need to understand their children, in language they can actually use. Until next time, trust what you see, name it accurately, and act on it early, because early is everything.